Welcome to the Do No Harm podcast, where we discuss the battle to keep politics out of medicine, with our hosts, Dr. Marilyn Singleton and Do No Harm's founder, Dr. Stanley Goldfarb. Together, we're talking with people to create a better healthcare system for all, one that's based on medicine, not division.
Do no harm. The core of the Hippocratic Oath and the role of medical professionals. Nowhere is this commitment more important than in the care of our children and teenagers, which is why we're fighting to curtail this unscientific and individually harmful practice of so-called gender-affirming care. Gender-affirming care is based on the dangerous premise that any child who has distress that he or she thinks is related to their sex should automatically be treated with social transition to the sex of their choice, followed by hormonal interventions and then possibly surgery to remove healthy body parts. Underlying mental health problems are usually not addressed, but some clinicians are fighting back.
We are so pleased today to introduce you to Dr. Elliot Kaminetzky, who's a clinical psychologist and the founder and director of the Center for Child Behavioral Health, as well as My OCD Care. He specializes in parenting-based interventions for mood and behavior challenges in children. He also specializes in the treatment of obsessive-compulsive disorder and other anxiety-based disorders. He has publicly spoken out against the unethical practices in the area of pediatric gender medicine and the silencing of concerned medical and mental health professionals. Dr. Kaminetzky recently opened Serenity Parent Consulting to provide parents with accurate information, useful resources, and to help them parent with serenity. Welcome to the show, Doctor.
Thank you so much for having me.
Well, let's just let Dr. Goldfarb jump right in.
Well, hi, Dr. Kaminetzky. It's great to have you with us today. And I think your particular expertise and particular interest, I think, is of great interest to the individuals who are listening in today. I've heard so many individuals worry about what would happen if their child showed up at the dinner table and said, you know, I'm concerned. I think I need to change my gender here. And this concern, I think, is so prevalent because, as you know, parents have been told that if they don't follow along with these desires on their children's part, that they're risking suicide in their children. So let me just start by asking you, what's your general view of how parents should go about dealing with this when their child expresses these kinds of interests?
That's a really great question. And I think what parents have been led to believe is that they need to suspend their parental instincts, their parental intuitions, what they know about their child, right? And kind of go along with a script, which is, that whatever the child says he is, that's what he is. And, that would mean changing names, changing pronouns, right? And even when parents don't feel like it's in the best interest of their child, they're kind of told to just suspend their parenting instincts. And I think it's important that these feelings are real, right? These thoughts are real. And the question for parents is, how do I respond to my child's distress? And this is not like a unique, magical distress that is to be treated the way, differently than you would other childhood distress, whether it's anxiety, whether it's, challenges with friends, right? And I think the fact that a child is willing to be open with you about something like this is special, right? And, being able to listen and understand and ask, reasonable questions without necessarily needing to insert, your opinion right away, but to just be able to validate your child's pain, understand what your child is going through, understand other contexts about what's going on in your child's life is so important.
Well, it's interesting that you have this parent consulting service, because what you say, this focus on the parents, is something that's so different and so important. Too many times we forget. And I wonder, you talk about leading the parents back to their parental instincts. Why do you think parents have gotten, how I look at it, kind of sucked in to just going along with what a child says, even though they know this is a child, their mind isn't formed yet?
Yeah, I think there's like a cultural trend that is, not just specific to gender. I think in a lot of ways there's been an undermining of parental authority, right? The way I was raised and the way my parents were raised is like, you don't talk back to your parents. Your parents are not your friends, right? They're your parents. And I think this is just one component of it, where parents have kind of put themselves on the same level, right? It kind of was like this healthy instinct of like, it doesn't have to be a totalitarian parenting, right? And I'm able to listen and treat my child with respect, just like I want respect. And I think that was a healthy instinct, but I think it turned over, right, to the point where parents don't feel comfortable setting limits, setting boundaries, reducing screen times, limiting what their children are accessing on the internet. And I think, once parents, take themselves out of their driver's seat and they put their child there, the places the child could go could be very much against their best interest. And I think like the idea behind the consulting services is to help parents get back into the driver's seat, help them realize that they had something in mind when they wanted to have children and wanted to be parents, and how even if it's gone on for a very long time where they felt like, I haven't been able to parent the way I would like to, that it's not too late. And you could, regain to be the authoritative parent, where you could be warm and you could be kind and fair, and also, right, have boundaries and be firm when you need to be firm.
Dr. Kaminetzky, I think one of the great ways that parents have been forced into a direction that they really don't want to take is this idea of suicidality on the part of the child. And I know you've thought about this and written about it. It's a sort of tell us for the audience what the real story is behind this threat that unless you go along with your child's requirements about gender transition, that you're going to have a child that's going to commit suicide.
Right. I think every parent's worst nightmare is harm coming to their child, and especially through suicide. So I think like once that has been brought up, right, I think, in, the nightmares of parents, it really could be weaponized, right? Like this greatest fear. So I think there is a suicidality problem among adolescents. And I think we as mental health professionals, as, any health professional who deals with children needs to be so careful and thoughtful about how we speak about suicide, how we address suicidality in kids. And that comes through research, right? Research is a very helpful way for us to do, to inform how we go about reducing the likelihood a distressed child doesn't, get to the point of suicidality, suicidal ideation, right? Like, so that it should be a very research-informed protocol on reducing it. rather than having it be research informed, it almost seemed like a movement, took this like parents' worst nightmare as a leverage to further, a very specific intervention for kids with gender dysphoria, questioning, which really is what is behind parents suspending their intuitions, right? Because parents are afraid that if I go based on my intuition, right, like look what that could lead to. And there is no high quality study that demonstrates that any hormonal procedure, any surgery, what they call gender-affirming surgeries or hormones, or even social transition, reduces the likelihood of attempted or committed suicide. And I think, there's the studies that are pushed forward are very low quality. I think we owe it to children that, to take suicidality very seriously, to not put forward misinformation about it.
Well, what would you suggest a parent say to the child, or what should the parent do? Let's say the parent hasn't had the child go to a counselor or psychologist, and we all know that somehow our peers seem to have more authority than parents or doctors or somebody who actually knows what they're talking about. What does the parent say to the child? How do they get them to say, gee, let's talk to somebody about this, let's explore this, without pushing the child farther away and kind of into the arms of the peer group that sort of led them down that path in the first place?
Right. I think like how we respond to our child's distress is very important. I think if a child approaches a parent, saying that, please, use my, I want to start hormones or else, I may become suicidal. I think it's important that children themselves know that, this doesn't reduce that risk. And if you're telling me that, you're experiencing thoughts about hurting yourself, about killing yourself, or anything like that, we really need to talk about that. And I get the sense very often that, children, by the time they come to their parents, they've been thinking about this for a while, and they get a lot of their information off the internet. In reading the information that they've been getting, they're actually told not to say that they're suicidal, because if they do, then, parents will say like, oh, look, you're not in the position to make these big decisions. So they're more often told that the message they should give is more like, this is going to, the research shows that if I don't do this, I may become suicidal. And I think it's important that both parents know, and that parents alert their kids to the fact that that's not accurate. And if you are experiencing this, like, it's something that we need to address, and we need to get a counselor or a psychologist that we really trust is going to help you, and we need to get you the care you need, rather than, what you've heard may or may not help you.
Oh, that is very helpful. And I think you're providing parents who are listening to this with really sort of an approach that they should take. But the last thing you mentioned, which is, I think, a concern that many of us have, is this idea of finding a counselor that they can trust. Because we understand that there are many organizations that, represent people, mental health professionals, that are foursquare in support of the idea that if a child declares, this interest in gender transition, that go ahead and support it. So do you have any advice for parents about how they can find the trusted counselor in this?
Yeah, I think that's a really, really great question. I'm part of an organization called Therapy First, previously the Gender Exploratory Therapy Association, but they are a network of mental health professionals who kind of recognize that the way the field is addressing children with gender dysphoria or gender questioning or trans-identified children are not actually helping them. So, there's that network that I think is important to plug into. I also think, you could even find a therapist on that network who could help you find, and that's one of the services that I provide within my consulting, find other therapists who are sensitive to that. And there are a lot more than you would think, right? And I don't even know the percentages of therapists who are dealing out very unhelpful information versus those who know what's going on and are just quiet and silenced about it. But, I think you find a therapist you trust, and it could be from one of these listservs. Very often parents are in groups, and they'll recommend a particular therapist who they trust, and maybe that therapist will know of another one who's not going to, just support immediate transition or anything like that. I will say, though, if it is an emergency, right, and the kid's actively suicidal, right, I think you need to go to the emergency room. I think that's also something parents should be aware of. And this is one of the darkest parts of the story, is that emergency room or psychiatrists or therapists at inpatient units or emergency rooms will sometimes apply pressure to parents to affirm their child's identity, commit to working with a gender center, or else they will involve CPS. I think that's really malpractice. I think it's deeply unethical. And I think it's so damaging because I think it makes parents know that this goes on and, will sometimes not take a kid to the hospital when they need to go to a hospital because they're really unwell and they're really, feeling suicidal. So I think that needs to change immediately. I think it's a very personal and it's a decision that should be left parents alone, and the pressure of medical professionals with either threats of impending suicide within their children or, involvement of child protective services, I think that needs to stop immediately. It's very disturbing.
The threats of CPS is something that comes up in so many other arenas, and I think you bring up a very good point because parents, there's a movie on Netflix about it. I mean, parents see these things, and it's so disturbing to think that a parent is afraid to take their child to the doctor because the doctor might be someone who they can't trust, and you don't know how they really feel. And speaking, it's one of those things you don't know what to do about that kind of global CPS reporting problem.
Yeah. In terms of being able to identify helpful professionals, my dream, as a child psychologist, is to really expand my child practice to be on a national scale, where it becomes a trusted symbol for parents that we are going to practice based on best available evidence, right? And we're not going to assert our values onto you as parents, and we will respect your values. And that's my dream for my child practice, the Center for Child Behavioral Health, that it just will be a place where parents could go and know that we're going to be evidence-based. And presently, a lot of therapists are not going according to the research. And I hope eventually it becomes unnecessary, but currently it seems to be.
Well, speaking of professionalism and evidence-based, have you gotten any pushback from others in your field because you've come out with your ideas that, of course, to me seem quite reasonable, but have other people said, no, it's the child, do what they want right now? Have you gotten pushback?
Yeah, so, in terms of my own coming out process, first, I've been struggling with this for a while, kind of knowing what I do reading what I've read and really doing a lot of my own research, and then realizing like, hey, this area of medicine and therapy is nothing like any other, and there's real problems here. And I checked, I first checked with trusted colleagues who I know take me at good faith and know that this is coming from a place of caring and a place of knowledge, right, and not bigotry. And I confided in them that I have these concerns. Almost invariably, every single one of them agreed with them. Some of these individuals have faced this issue in their own family and were very concerned about the care they've received. These, giants in the field were agreeing with me and were also saying, best of luck in terms, right? This is so politically fraught that, you're going to get canceled. And they were not necessarily willing to be open about their opinion, with some exception. So then I'm like, okay, there are so many professionals who I really respect who are just not talking about it. I felt like really it was my responsibility to be among those. And there are certainly not the first, right? Many professionals, and they're coming in increasing numbers, are talking about this. So I posted about it on Twitter, and I got very little pushback. And I'm like, okay, I'm probably late to this. It seems like we're ready as a society to have this conversation. Europe has been having this conversation for a long time. So it seemed like this was the time to be more open about it. The pushback that I did receive is I, moved from Twitter, which is more the public arena, to Facebook, which is more like my own private professional circles, friend groups. I posted it to 2 Facebook groups. One is the biggest private practice group for therapists in private practice, aka TIP. Presently, I just listed a lot of my concerns, such as lack of evidence for efficacy of puberty blockers or a child's ability to consent to them. So presently I'm blocked from that group and no longer have access to, 30,000 other, or 20-something thousand other professionals, which is really a shame. But they have been an activist group for a while. Within a group I really respect, a group of anxiety specialists, I got a lot of people saying thank you. A lot of people privately saying thank you so much for bringing this up. I have, suddenly 40% of the patients I have are gender nonconforming, and a lot of them have autism and want surgeries. Thank you at least for bringing up this discussion. And it was well received, with the exception of, the therapists who seem to be activists at, first and therapists second. Another category is therapists who just seem to not have access to information outside of mainstream information, and they were kind of recycling a lot of misinformation. So, for example, a psychologist who I really respect discussed, let's say, puberty blockers, how, even what she called cisgender, precocious pubertal kids will go on a puberty blocker, and that's totally, no one has raised any eyebrows about that, so clearly it's safe for kids to take them. And just saying that point reveals such a degree of ignorance of how different these administrations are, because for precocious puberty, you'll stop the puberty blocker once it's time for them to go through puberty. They'll experience puberty and then move on. Comparing that with, individuals who are taking it for gender dysphoria, they're going to start it at the point which precocious pubertal children will stop it. And they're going to totally avoid, going through puberty. And that's not something that has been shown to be helpful, effective in any way. And it's claimed to be reversible, but it's not. So the fact that this psychologist who, claims to be an expert in this area demonstrated such a profound, misinformation and misunderstanding was very telling. And that therapist blocked me, which was unfortunate, because it's someone who I would have liked to speak to about this. So I would say the pushback so far has been minimal, but I'm not quite well known in this space yet. So, I plan to continue working in this space and, accept whatever pushback comes my way.
Well, thank you very much, Dr. Kaminetzky. And I'm going to ask you once more to just mention that network for the parents that might be listening in about where they might be able to identify a therapist that will approach it from the sort of direction that you have.
Sure. That's therapyfirst.org, based on this idea that, before going down a medical pathway, maybe, a child should certainly consider therapy first, in line with, many European countries who did way more research on this. Additionally, like within my consulting company, I help match parents to therapists in their area by speaking with the therapist first and just trying to get a sense of their understanding of the issue, their approach to helping children, and their experience working with children who have, our gender questioning. And, if they kind of come off like an ideologue, I think it's important the parents know that. So, I think some people say, like, in certain circumstances, no therapy is better than bad therapy. But good therapy is certainly better than no therapy. So, like, if you could find a good therapist, whether through these networks, through someone who will help you find, like, a trusted therapist, I would certainly recommend that.
Thank you so much. Now, how can listeners reach you? What is the website of your Serenity Parent Consulting Service?
Sure. It's serenityparentconsulting.com. That's the consulting service, and we, help parents, anywhere. They're able to just book a time to chat with us, and we'll see if we're a good fit or if we know someone who would be a good fit for them. My child psychology practice currently serves individuals in New York and New Jersey, but we hope to expand, and that's childbehavioralhealth.com.
Well, thank you so much, and thank you so much for coming on the program and the work you do. We really need more people like you.
I really appreciate that, and thank you for having me on, and thank you for running this podcast. Sounds great. Great talking to you. Take care.
And I'd like to thank everyone for listening, and thank you for supporting our efforts to protect patients and doctors and healthcare from any kind of divisive ideology. And as always, feel free to visit us at donoharmmedicine.org. Thanks again for listening.